6 o'clock, we'll call the meeting to order. Begin with a moment of silent prayer. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Roll call, we do have a quorum. Supervisor Carr is excused. The affidavit of posting. This is a meeting of the Washington County Board of Supervisors. Prior to this meeting, public notice was given by posting a copy of the agenda in the office of the county clerk and emailing the agenda to the West Bend Daily News, which is the official newspaper. In addition, the agenda was emailed to CNI newspapers, Express News, Kewaskum Statesman, Milwaukee Journal, WIBD, WMBZ Radio, and WTKM Radio. The above action is in conformity with the state of Wisconsin open meeting law. We can continue on with the consent agenda. Entertain a motion to accept. Supervisor Mahalik, second Supervisor Bullowa. Any additions, any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Okay, we'd like to move resolution 2018 resolution number 9, commendation for Mary Wolf before personal appearances. Do we have any objections to that? Okay, begin with or motion to need a motion to accept Basil and Schleif. All in favor? Aye.
Commendation of Mary A. Wolf. Whereas Mary A. Wolf has contributed more than 28 years of loyal service to the citizens of Washington County, and whereas Mary A. Wolf has chosen to retire from her present position of custodian in the Administration Department Maintenance, now therefore be it resolved that the Washington County Board of Supervisors pause in its deliberations to pay tribute and to commend Mary A. Wolf for her 28 years of meritorious service. Be it further resolved that on behalf of all citizens of Washington County, this body does herewith extend to her heartfelt thanks for her many accomplishments and successes. Be it further resolved that a copy of this resolution be forwarded to Mary A. Wolf as a token of appreciation on the part of this board.
Congratulations, Mary.
Oh, thank you.
28 years. Would you start when you're 12?
Not quite.
Okay. Well, I'd like to present this clock for you for your 28 years of service to the citizens of Washington County, taking care of cleaning up our messes. And we make enough of them, don't we? So,
Oh, yeah.
here you go.
Thank you.
You have any words to say?
Not really. I guess you'll have to tend your own toilet paper.
Well, thank you very much. Moving on to personal appearances, letters and other communications. A letter from former Supervisor Thomas Niebler.
In Tom's letter, he says, "Please thank the county board and everyone in the county clerk's office for the framed commendation. I have many fond memories of my time on the board, and this will be a constant reminder of my time there." Tom.
Okay, moving on to B is a proclamation celebrating Older Americans Month.
Whereas Washington County, Wisconsin includes countless older Americans who enrich and strengthen our community, including the 131 residents at the Samaritan Health Center, and whereas the Samaritan Health Center will celebrate 50 years of engaging and supporting older adults, their families, and caregivers this May, and whereas Washington County acknowledges the importance of ensuring access to basic physical, behavioral, and socioeconomic needs, including access to services that provide for the community's health and physical well-being, encompassing all ages, ability, and circumstances. And whereas these activities include the Cycling Without Age program that provides outdoor rickshaw rides for Samaritan residents by pairing them up with volunteer cyclists in the community. And whereas Washington County can enrich the lives of individuals of every age by supporting independent living by taking residents on bicycle rides through the city, to the park, visiting local business, or even riding past the house they used to live in, encouraging activity, citizenship, and building intergenerational relationships, and promoting a culture of health where Washington County is a healthy place to live, learn, work, and play. Be it therefore proclaimed that May 30th, 2018 shall be the official celebration of the Samaritan Health Center's 50th birthday, including the opening of the Samaritan Time Capsule from 1993 and the kickoff of Washington County's first Cycling Without Age program, bringing the community together through the planning and attainment of a healthy, social, and beneficial connection of generations. Be it therefore proclaimed that May be recognized as Older Americans Month in Washington County. I urge every resident to take time during this month to recognize older adults and the people who serve them as vital parts of our community.
Thank you. Okay, C would be QuadMed On-Site Employee Healthcare Center update. Okay.
All right. Thank you for everyone. I'd like to quickly introduce myself. I'm Todd Scott. I'm the Director of Human Resources for anybody who doesn't know me. I'm also pleased to have with me Mike Newberger, Senior Vice President from Hayes. He's our broker that we use for our insurance business, as well as I have Sarah Stiefvater. She's the account manager with QuadMed, and Holly Schneider, who is our nurse practitioner we have at our on-site clinic. So each of them will have a chance to speak with you briefly today. What I wanted to do is just give a chance for each of you to get a little feel for kind of where the on-site clinic is. No arrow, okay. From an agenda standpoint, talk a little bit about Washington County's healthcare cost and kind of our history. Specifically kind of where we've come from and why this clinic is going to be important to us. Talk about the Employee Health Center and the impact to health, as well as our Employee Health Center utilization as of today and where we plan to go with the future. Quickly, I guess a little information I wanted to share. The clinic has been open about 10 months. And although it doesn't show in numbers, I know of two circumstances specifically where there were people who were not seeking health care, one of which the person had high blood pressure, may have or may have not known that, but as a result of the on-site clinic is now doing some things about it to take care of themselves. The other person had an irregular heartbeat, also something where the person, at least in the conversation I had, wasn't fully aware and is now doing something about it. Both of those cases could really have ended badly if the person just didn't pay attention. And so those are direct examples of kind of what this on-site clinic has done for us. For that reason, now I'd like to turn things over to Mike Newberger from Hayes, and he can walk you through some of the rest of the presentation.
Well, good evening. As Todd mentioned, my name is Mike Newberger, and I'm a Senior Vice President at Hayes Companies. We've been working with Washington County for a number of years now. And as Todd mentioned, what I wanted to do was walk through some information as far as historical costs. Why did we go down the path of looking at an on-site clinic? And so as you can see up on the slides right now, we have a 4-year history as to where your costs have been compared to the budgeted amount for Washington County with respect to your health insurance program. Under 2014, you can see that we are obviously over budget. The budget ran at $8.5 million, but yet the health plan ran at $10.2 million. In 2015, it got a little better, still just a little bit over budget, where the budget was $8.1 million, and then we actually came in at $8.3 million. From there, we got a little bit better and started running under budget. The budget was at $9.2 million. We ran at $7.7 million. And then in 2017, this past year, the budget was at $9.2 million, and we came in at $7.8 million. A couple things to take note of. One of the concerns we had was that back in 14, especially in 14, a little bit of 15, when you run over budget that much, your reserves tend to get depleted. And our reserves were definitely depleted. And so what we wanted to do was do some things where we could manage the plan a little bit better, bring the costs down, and then be able to build that reserve number up a little bit more. And so as you can see, in 16 and 17, we obviously were under budget, but that helped building up our reserves so that we were in a much better position financially. Some of the things that we did, we want to just give you high-level information. And you need to take a look at, when you look at the budgeted numbers, for example, in 2014, and when you look at that actual number next to it, we're getting those numbers in the middle of the year. So things can't be done until the next year. So when you look at the numbers, the things that we did to address the $10.2 million really can be seen in the plan year for 2015. That's kind of how things work as far as how the renewal calculations are done. They need to be done 6 months in advance. And so that's how we attacked those numbers when we were significantly over budget. But you can see in 2014, the budgeted cost, as I mentioned earlier, was 8.5. We ran at 10.2. Plan changes we made there was just simply to make some increases in employee contributions. Then in 15, budgeted cost was 8.1, actual cost was 8.3. But again, based upon the data we had from the prior year, we started to make some plan design changes. So we again increased employee premiums. We eliminated Plan F, so now we only had 2 plans available to employees to select from. And those 2 plans, we adjusted the cost sharing, where we increased the deductible for the HSA plan up to $1,500 for a single and $4,000 for a family. And then for the HRA plan, we increased the deductible and coinsurance. Deductible went up to $1,500 for the single and $4,000 for the family. Again, we're just trying to give you high-level information on what was done to those plans. In 2016, you can see, again, repeating the numbers, $9.2 million for the budget, $7.7 for the actual cost. Here we did some additional work as far as splitting out the employee premium share. So basically what happened here was anyone hired prior to February 28th, 2016, their cost share was at 6.5%. And then for anyone hired after February 28th of 2016, we moved their cost share up to 12.5%. So the goal here was that we'd have new employees come in at 12.5%, and then for anyone hired after or prior to that date, the 6.5% employees, each year we'd start to move them up a little bit more to get to that 12.5% number. Yes, sir.
Thank you, Mr. Chairman, and Todd, maybe you'd be able to answer this. What year are we looking at that we're going to have both groups the same? Is that 2022, 2024? Where do they coalesce?
So the initial plan was that we would be increasing those employees, as you noted here, the 6.5%, 5% per year until they reached 0.5% per year until they reached that 5%. We're going to do it really quick.
Yeah.
0.5% per year until they reach that 12.5%, and then go from there. So that's our initial intention. Based on how our plan is running and where our costs go, things could be modified, but right now that was what we planned on doing.
So it's a 12-year plan then
Potentially.
too. So we're 2 years into the 12-year plan is what you're looking at then?
Correct.
Thank you.
So in 2016, below that employee premium split, we also eliminated the HRA plan. So now there is only one plan available to the employees of Washington County, which was the HSA plan, when you have multiple plan options offered to employees, you tend to have what we call adverse selection. And when you have high adverse selection, costs and claims tend to run higher than they would traditionally if you have no adverse selection. So by having just one plan design offered to the employees, we eliminate adverse selection for Washington County.
Supervisor Jenkins has a question.
Thanks, Chairman. I just have a question that might be a little simple, but why are our budgeted costs, why do they continue to be so much higher? I would think we would have learned from 14 to 15 that we don't need to budget as much, and now we're seeing a $2 million difference, at least the past couple of years. Is there a reason for that?
Well, again, that part of that is when the calculation is done. It's always done 6 months prior to the actual end date, so you don't truly know how you're running for that given plan year. You probably have 5 months worth of data, but you don't know exactly how you're going to end up at the end of the year. So we tend to be very conservative in that we want to make sure that you're under budget for those calculations. Additionally, I mentioned the reserve. We needed to make sure that we got the reserve up. So that was a little bit by design in that we'd want to come in under budget, most definitely, because those dollars under budget can then go back to support the reserve requirement that we have.
So succinctly, 2014 scared the hell out of us.
Yep.
And 2015, when we budgeted, looked a lot worse than we ended. You'll notice we ended a deficit, but it looked terribly worse than that in May. So by the time we're budgeting in April, May of 2016, we had been scared twice, and we weren't going to get scared a third time.
Okay.
So we're getting now to the point, and you'll see in the state of the county, I address this as well.
Okay, awesome. Thanks, guys.
Okay, great. And so now we go on to 2000 and, we'll end 2016 where we began an assessment for the potential of an on-site clinic. Okay. We go into 2017, and again, we're going to increase employee premium share, but it's going to be just for those employees hired prior to 2/28 based upon that 0.5% increase we talked about every year. In July of 2017, we opened the on-site clinic, and then we assessed the marketplace for plan administration and network options. We wanted to see if we can improve the overall provider pricing that we have within the insurance program. And so we did a very extensive marketing analysis to look at various carriers and various TPA options that were available in the marketplace. So we go into 2018. We do, in fact, change the plan administration and network to UMR, which is an offshoot of United Healthcare. And we selected the Choice Plus network, which again is a United Healthcare network. The estimated savings there is about 12% savings. So again, we're making steps to try to improve the overall efficiency of the plan and make it much more financially viable as we go into the future. We again increased employee premium share for those hired prior to 2/28, another 0.5%. And then we conducted wellness screenings for employees and spouses on the health plan and provided HSA incentives. The nice thing about that is that it was kind of twofold. We got people to do more of the wellness programs that they needed to do. Obviously, it's going to help them long term. But then we also ran those through the employee health clinic. So those individuals who may not have gone to the clinic yet did have an opportunity to do that to get their biometric screenings. So again, it was kind of an introduction, an encouraging introduction to go into that wellness clinic so that they understand what it looked like, how it worked, and just get a better feel for it so that when they needed to use it in the future, they knew exactly what to do and where to go. Okay? So just a quick overview on the clinic. I'm not sure a lot of people understand how the clinic works or who we're working with on that clinic. It's actually a shared clinic with the city of West Bend. And the employees who are working for both Washington County and the city of West Bend are eligible to go into that clinic, those people who are eligible for health insurance. The clinic hours are Monday, Wednesday, Friday, 7:30 a.m. to 1:30 p.m. And then on Tuesday and Thursday, it's from noon until 6 p.m. We try to stagger that so that we can make it available to people who might start early or people who might start late. The clinic is on site here. So I'm not sure if people have time after the meeting, but I think it might, be open where we can get a quick tour of it. And then Quad Med, who we partnered with, again, we went through an extensive marketing and RFP for these services, selected Quad Med. They have a local presence here. They have clinics also at West Bend Mutual, Ozaukee County, Quad Graphics, and then Briggs & Stratton, to just name a few. Okay. So I'm now going to turn it over to Sarah to walk through a little bit more detail what's offered at the clinic and then some of the projected savings that we had during the RFP process.
Thank you, Mike. Thank you for the opportunity to be here tonight to talk about the clinic, one of my favorite things to do and something I get to do every day. So I'm pleased to be with you tonight. So I do want to, again, introduce Holly. Holly Schneider is our nurse practitioner that serves as the provider and sees the individuals that do come into the clinic. So Holly, if you want to say just a few words about yourself.
Again, my name is Holly Schneider. I am a nurse practitioner. I've been a nurse practitioner for 9 years. I've been a registered nurse before that, longer than I would like to discuss. I'm local. I live in Newburgh. I live and play in this county, in this city. I have worked in the city for a long time. I worked at St. Joe's for a long time. I've also volunteered at the clinic, as well as being with Quad Med for the past almost 2 years. Thanks.
So just getting back to what's up on the slide, just a couple of things that I want to walk you through. Again, just to kind of, as Mike said, to give you an overview of what we do at the health center. And he mentioned biometric screening, so we did do that last fall. So we had all of the individuals come through. We did, blood work, gave them their feedback on, how are they doing? How's their overall health? And that's what biometrics are intended to do. Some wellness initiatives are underway. In fact, we just kicked off a weight loss challenge with the group for the next 6 weeks. We're going to be challenging them to do some things to work toward weight loss. So we're just getting that going. A part of Holly's job is chronic condition management. So high blood pressure, diabetes, those kind of things where people have a condition that if they manage it, can make the long-term much better, more positive outlook for them. So that's a big part of what she's doing. And then another piece of it is we work with the HR department when they have new employees starting with Washington County, bring them down for a tour so that they know from day one where the health center is located, a chance to meet the staff, because it's Holly, in addition to Liz, who is our medical assistant. That makes up the team in the health center, and get a chance to meet them and just see what the facility looks like. And if you do get a chance to visit us, it is a beautiful facility. They did a great job in building it out for us. Just touching again on some of the services that are provided, preventive services. So according to the ACA and the rules of the law, preventive care is covered at no cost. So those kind of services, when someone comes in, there's no cost to the patient for those services. Routine office visits, so things like coming in with a cough or a sore throat or an earache, those kind of things, do have a $25 copay. That's how the health plan itself is set up. So that's part of just a routine visit to the health center. Prescriptions are generic, so all of the prescriptions that we dispense, and we have a very limited list. It's about 50 medications that we actually are able to dispense. We're not a pharmacy, but we do have what we call pre-packed meds that are all packaged up and ready to go, and we can give them to someone, at the end of their visit. It's $5 if it's something that's not considered preventive. Preventive medications are covered at no cost. So really very minimal cost out of pocket to individuals that use the health center. And then lab fees, we do have a limited scope of lab services that we're doing as well. They can have them done, if Holly orders them, they can even bring in outside lab orders. If they're getting a regular blood test, maybe under the guidance of another physician, we can run those here and get the results back to their provider that may not be here in the health center. So another service that we can provide to kind of expand how we can be definitely an affordable and convenient option for the employees and their families here at Washington County. A couple things we're really proud of, the last two things down there at the bottom in terms of survey results. When someone comes in for a visit, we give them an opportunity to do a survey quick. It's like just a handful of questions that we ask them about their experience. And you can see that their overall quality of care, they're giving us very good and excellent ratings. And then in terms of their satisfaction with Holly as the provider that they're seeing, they're at 99%. So she said she's going to work on getting that up to 100%. So maybe when we come back again, it will actually be there. On to the next slide. Again, just to give you some idea of the activity, if you look, we're looking at the first 6 months. We opened July 10th, so not quite the full month of July, but July through December, we had 374 visits to the health center. I'm just in the process of generating the next quarterly update, and I can tell you the numbers look great for through the first quarter. And then if you look at the EHC, that means Employee Health Center, the utilization that we projected for year one was 40%. So we said, okay, if we can get 40% of Holly's time utilized on a consistent basis, you know, that's great. We're well above that, I can tell you that as well. So we're happy to report on that. As you can see, it's 68%. And I think through the first quarter, it's even improved a few percentage points more. So we're doing well there. And then just estimated redirected savings, and what we're saying there is in terms of impact on the health plan, you know, what we've recognized through those first 6 months is right around $70,000 of savings that we're already seeing that potentially are going to impact on the plan. So the chart over to the right-hand side, I guess it would be, again, is just showing, I'm not sure why that first number isn't.
All of them didn't show up for
All of
whatever
them,
reason.
so I don't know, do you want to?
Sure, I can run these through real quick. So year one savings, that number in the dark green is $85,000 of EHC projected savings. Year two projected savings, that light green is $314,000, and then year three projected savings in the darker green is $477,000.
Supervisor Bossert has a question.
Yep, so I'm looking at like the year three savings. Is that the year two savings plus additional from year three, or is that just year three savings?
Yeah, that's just year three
So
savings.
just in year three, we're gonna save, what'd you say that's about? Because that's just a bar graph.
$477,000. That's
Okay.
projected based upon the
Yeah.
RFP process. We want to firm all these numbers up once we have a full year's worth of data. So this is off of the RFP, and so as we get our full year in, we're going to update all of these data points and project them out for you.
All right, thank you.
Supervisor Galitz?
Yes, thank you. Regarding the savings, what comprises that 70,000? Is that what was projected been saved by the plan if users went to a network provider?
Yep. Yes, that would be correct. We're assuming that those are savings if they sought care outside of the health center. Correct.
Supervisor Schleif?
Thank you. Just a couple easy questions. Is Holly working for us or for QuadMed?
She is a QuadMed employee.
And as such, when she goes on vacation, somebody else fills in for her?
Correct. Yes.
Thank you.
No vacations, yeah. We have to give her a little time off. We're trying to be nice. We're trying to be nice.
Supervisor Merton?
I'm just thinking of, these are employees plus their spouses or children?
Correct, yes.
Okay, and so, they can come in anytime during those hours? Do they do, inoculations, immunizations?
We can to a limited basis. Again, we kind of have a narrower scope. We don't typically see children like under the age of 2, just because there are certain vaccines and those kind of things that we don't keep on hand, but we wouldn't typically see the very young children, but certainly 2 and above, we would definitely see them. And we do want them to schedule an appointment just because we are pretty busy. Wouldn't, you know, occasionally we could take a walk-in, but typically we want them to schedule the appointment. And they can do that by calling, they can do it online, and we also have an app that they could schedule their appointment.
Thank you.
Thank you.
Supervisor Parsons?
Thank you, Chairman. I see you got combined Washington County and City of West Bend. Is there any way we could break it down so we know exactly what the county number is versus the cities?
Yeah, absolutely. We can follow up with that. Again, this was through the RFP process, so we wanted to keep it as a combined number, but we can definitely break that out for you guys. Absolutely.
One more slide, Mike. I think there's one more slide.
Oh, sorry.
Sorry. because we got to look forward. We have to look to the future. And so just again, continuing with the wellness initiative. So we're working closely with Todd and his team and figuring out what are some of those things that we can do to continue to support the Washington County employees and their families, continue with that chronic condition oversight as Holly gets, you know, more information, learns her patients better, that just becomes more effective, you know, as she cares for them longer. And then potential enhancements that we're looking at, we're considering expanding some hours. Right now, as Mike went over the hours, it's 30 hours a week. So, you know, is there an opportunity, you know, can we serve a larger population if we move to 35 or potentially 40 hours a week? So in conjunction with the city, we're looking at some opportunities there. Potentially occupational health, which would be things like pre-employment testing. For some of the positions that's required, we could look at that. And then physical and occupational therapy as well. So looking at being able to broaden some of the things that we're doing as well.
So all in all, I believe that's the presentation we had for the update on the on-site clinic. I know there's been questions here, but we obviously open it up for more questions.
Supervisor Bossert.
Okay, so we know 68% of our time right now is being utilized, which is excellent. Do we know the percentage of employees, and maybe it was covered and I just missed it, but do we know the percentage of our current workforce that is utilizing the on-site clinic?
Yep, it's right around 40, I think 43 through the first quarter. About 43% have actually been seen for something other than their biometrics.
Okay, so 43% right now are utilizing it. So that means there's an opportunity to capture another 57% of our insured workforce and get them utilizing this and essentially saving us money and saving them money and better health care.
Yep.
So,
absolutely. So we have a marketing person assigned from QuadMed that works with Todd and his team on promoting things, you know, giving people, reminding them, like we just did a children's physical campaign. So if they have back to school or sports physicals that they need, hey, bring them in, you know, we can see them at the health center. Holly's going out and meeting with individual departments within the county to just make sure they know who she is and, you know, or like recognize her face. So we're doing some things definitely to raise that awareness and make sure that people know what we're doing at the health center. Yep.
Also, the other thing that I think is important, you talked about the 40%. When we went through the RFP process, and including with QuadMed, consistently what we heard from every vendor was first year, anticipate about a 40% penetration of your workforce at the end of the first year. So we're trending really well. At the end of 3 years, they're saying 60%, and we're really hoping to far exceed that. But again, we're right now on track to at least meet what was expected, if not exceed. So things are going well.
And we're probably never going to get to 100%. But if we're getting into 60, 70%, that's excellent.
Correct. Thank you.
Yep.
Supervisor McEwen.
Could you go, the original slide, could you go back to the first one that you had up there? That showed the cost and the,
Got it.
way at the beginning.
Yep.
Yeah. So during that time period, do we have a correlation too with the number of employees within the county? I was trying to look, I can't find our number of employees per year, full-time equivalents. Would anybody be able to have that?
We don't have it listed there. I can tell you it was fairly consistent. It's down slightly, but slightly maybe 10. It's not radically different from what it was in 14.
One of the things that we do as an organization is we do track things on a per employee per year basis. But I know the county likes to work in, you know, the whole dollars for the entire year, but we do definitely track that year in and year out.
Yeah, I was just going back through some old numbers, and you know, there was other drops in other years if you go back farther, but I couldn't tell if we had some, you know, as you have retirements too, I guess, with the self-funding, right?
Yeah, I think your point is, I think if I'm following it, well taken. There's always going to be some peaks and valleys to how insurance works. High cost claims and other things can make some radical differences in numbers. I think when I came on board in 14, middle of 14, in fact, the day before I started, I had somebody named Josh who said, hey, we got a problem. We're going to have a 40% increase in our health insurance next year. And I thought, oh, this is going to be a nice way to start a new company. there were lots of opportunities for how to take a look at the health plan and to kind of put it back on the right track. And so that's really what Josh and I and the HR team, you know, what Mike and Hayes have really done is to say, okay, where do we start? How do we do this? And not upset the apple cart. At some point, there's a floor as to how far you can go and still provide reasonable coverage. And then you're going to start to see a trend going back up. I don't know where that floor is, but I think we're continuing to look at opportunities to bring the cost down. I think there's still some room. What that is, I don't know yet.
Sure. Thank you.
Supervisor Krebs.
Thank you, Mr. Chairman. Do we have a per employee cost of what, like, 2017 we spend per person at this point?
I don't have one with me, but as I mentioned earlier, we do track that without question within our organization. So we can follow up with that information.
Okay, thank you.
Supervisor Merton.
Trying to keep up with who's our provider. Quad Med is the provider for the clinic or provider for our health insurance, and where does UMAR fit in?
Sure. Okay. So we are a self-insured health plan, meaning we pay all our own bills.
Right.
We have a third-party administrator that we use to review all our claims and decide, based on the plan document we've put together, what should or shouldn't be covered. And so we've just made a switch in 2018 to use UMR, which is a division of United Healthcare. It's kind of the county division of United Healthcare. And then Quad Med is really who we're using simply for the on-site clinic. So they're outside of United Healthcare, UMR, outside of our plan altogether. It's specifically just something to provide the day-to-day care for employees if they choose to use them at a cost that is much more controlled.
Supervisor Galitz.
Thank you. I was just curious, what is our specific and our aggregate limits?
75?
Yeah. $75,000 stop loss specific level, and then the aggregate's 125%.
Thank you.
So 75 has been. It's been something since I've been here. I've said we got to take a look at every year, and we do every year take a look at where are we trending and where are we going. I think we're getting closer to pushing that up. I know the insurance companies would love to push it up, but so far, based on how we've trended, it wouldn't have been in our best interest to do so. Hopefully, it will be soon.
Okay, any other questions? Okay, thank you.
Thank you.
State of the county.
You move meetings tonight, you'd be surprised how long this is going to go. All right, well, on an annual basis, I get the opportunity to talk to you a little bit about the state of Washington County. And so the month of May, we decided to make it our month. Next month, you have a couple of other presentations, and we thought we have a relatively light agenda, so we'll spend the next hour to 2 hours talking briefly about the state of the county. This is just a little bit of an outline of what we're going to go through. You'll see highlighted, again, our vision, mission, and values. For the supervisors who are new to the county board, you've seen this in a couple of presentations now, and you'll probably see it forever and ever and ever and ever as long as you're on the board. I'm going to talk just a little bit in the presentation about strategic results and how we connect the vision, mission, and values to the work that we do each and every day. It's kind of like a puzzle piece. We'll get into results-driven government, how we've utilized that plan that you're looking at on the top, how we've connected it to the dollars and cents that go out the door and the largest public policy decision you make every year in the budget process. We're also going to circle back. Many of you I know, even those of you who are just new to the county board, have been on other boards, and you've heard me talk about the 4 goals for 4 years, talking about fiscal responsibility, also really specifically talking about a little bit what you just heard about with health insurance. But I'll readdress those. The first time I presented those was in 2016. And again, some of those of you who are on other boards when I came to your town, city, or village might have heard of that. We'll do some highlights for 17 and 18, and then we'll end like we always do with the goals for the 2019 budget. I promised to beat you over the head with the results and the priorities that you have established and that we work off of, and so I'll continue to do that. These are all of those. I want to draw your attention to these 5 things with the following illustration. On Monday, Chairman Krefall and I attended a viewpoint luncheon hosted by the Wisconsin Policy Forum down at the Italian Community Center in Milwaukee. Shout out to Pete Sorcy and his family. We had a really interesting about hour and a half presentation and lunch. The Policy Forum, if you're not familiar with them, have been around in the Milwaukee area for quite a long time. They recently merged with the Wisconsin Taxpayers Alliance, which many of you I know are familiar with, to create the Wisconsin Policy Forum. So they've kind of taken themselves from pretty Milwaukee-centric, Milwaukee-specific, to much more statewide based. And they had a very interesting presentation where they talked about whether or not municipalities in the state of Wisconsin are at the fiscal breaking point. I thought it was a really fascinating piece when I got some of the literature on it and mailed it to me. So I thought, what a better way to start off the new chairman than to go down and hear this presentation and panel discussion. So the presentation was relatively short, 15 minutes maybe, by the executive director of the Wisconsin Policy Forum. He talked about some of the statistics, the state of Wisconsin. For those of you who frequently check your email, you've probably seen by now that I forwarded you a link to the video. It's about an hour. So if you have an hour's worth of time, instead of watching your latest version of Netflix, maybe watch this video. It's really fascinating. After the presentation was done and they talked about this looming gap that all of these municipalities across the state of Wisconsin are seeing, they went in and dove in with 4 panelists. Representatives from the city of Milwaukee, the city of South Milwaukee, the city of Beloit, and the city of Racine. And they all got up and talked in great detail, ad nauseum, I thought, about how things are just so bad and they have very, very few resources to pull from anymore, and the state needs to give them flexibility and send money their way, because it's just that terrible. And I, at least 4 or 5 times, had to reach over and hold Chairman Krefall down in his chair so that he wouldn't stand up and start hollering. But it was a really interesting hour and a half of listening to what things are like for communities that haven't seen this coming or chose not to see it coming. And I think it is a great credit to this county board and to county boards for decades beyond, setting priorities and living up to them. And what we're going to talk about, not only in the next couple of minutes, but over and over as I continue to beat you over the head with it, you are leading the state of Wisconsin in solving this problem. There's a reason that gap for us is still 5 years out, and unlike some of those municipalities that I talked about, we are not looking at a breaking point. There is not a fiscal cliff in Washington County. It's because of the work you're doing and the priorities you've set. So let's talk a little bit about how we are doing, what the results that we've produced in the last few years look like, and exactly what the state of the county is. So if you look at the graphs here on this slide, you'll see that really in 2016, when we did our initial round of priority-based budgeting, we were in relatively good shape compared to other communities. And I speak to that, as I mentioned, with decades and decades of good fiscal management by county boards. So we started off in pretty good condition as you compare us specifically to other priority-based budgeting communities. 2016, we're much better job of quartile 1 high priority programs are what kind of drive our organization. What I want to draw your attention specifically to, though, is on this side of the graph. on the very far right side in 2017 and 2018, you can see we've started to really focus in, eliminate those, minimize those programs in quartile for the lower priority programs. And that's been the focus basically for the last 2 years. Looking at it in a little bit more detail, drilling down a little bit farther, you can see not only are we doing a good job in that quartile 4 ballpark of lowering our costs to the tune of $1.1 million from start to where we are today, we're redirecting those resources up into our highest priorities. You're literally putting your money where your mouth is. When you say there's something that's a high priority for our county, you're putting our money in those spots. And you're saying, look, we don't have taxing authority beyond net new construction. We're not going to go to things like wheel taxes and other things. We've had those discussions before. Instead, we're going to take money from those things which aren't priorities and move it to those which are. Again, that's as demonstrated on Monday at that presentation I was at, that's leading the state of Wisconsin and quite frankly leading the country. So, results-driven government, here's exactly some of the specifics of what you have done over the course of the last 12 months specifically to achieve some of the graphs and charts that you just saw a moment ago. Implementing the Park Fiscal Sustainability Plan. This was not only something that had a lot of individual tasks related to it, which caused for difficult decisions and consternation at committee level and even at the board level, but it was a strategic priority of yours. For those of you who are new to the board, every 2 years we go through a strategic planning process, and at this point, about just under 18 months ago, we did the same thing, and developing this fiscal sustainability plan was one of those things. If you want to know, as a new supervisor, how we got from 4.1 million to 3 million, and you'll see that number over the next couple of years continue to drop, and those resources redirected up towards the top. This is one of the major initiatives that we've done. Hasn't been popular? No. Has it been fun? No. I think, would it be the first choice of things to do? Is it a platform you run on as a county board supervisor? Yeah, probably not. But when you know that breaking point that's happening in the city of Beloit and the city of Racine, the city of Milwaukee are out there, and the alternative is to do nothing and be in their situation, I think every day of the week and twice on Sunday you're going to pick this one. And again, you're leading the state by doing that. Economic Development Washington County Sustainability Plan is being implemented as we speak. A heads of terms agreement is nearly reached with EDWC, again leading the state of Wisconsin. We're excited to talk about some of the projects that are in the pipeline that you'll hear about in the next couple of months when EDWC comes and does their presentation. Next, the Transportation Network Sustainability Plan. I know this is one of the things from our one-on-one meetings, me and you as individuals. I know a number of you highlighted this as your favorite accomplishment in the last 2 years, or maybe in your last, in your term as a county board supervisor. This is damn impressive. That document, a ton of credit goes to Josh Glass and Scott Schmidt for the quality of that document, but to the county board for having the vision to be able to say, we're not just going to sit back and wait for someone else to just fix it. We're going to come up with a solution for ourselves. Now, a plan is only a plan, right? It's a piece of paper that sits on a shelf. If you don't use the plan and you don't implement solutions to enact the plan, then the plan's just as bad as any other strategic plan that sits on a shelf. You're going to get the opportunity to solve that problem and implement that plan in the next couple of months. And whether it ends up being by borrowing some money to get roads going, or whether it is by finding another funding source or redirecting assets just like we did here with Quartile 1 and from Quartile 4 programs, although I'll tell you that'd be quite painful. But we can do it, and if you tell me to do it, we'll do it. But the next step in the process is to make that plan come alive and make it happen. And there are not very many other municipalities in this state that are doing that. So I challenge you to make that happen and give us a solution to solve that problem. Finally, reinstatement of OWI TAD program. This is an outstanding example of redirecting resources from Quartile 4 programs to Quartile 1. Really, you have this opportunity last month. All of you saw it. It was a fantastic chance to really make a difference. And I say that with heartfelt heartfelt thanks to, because it's really easy to get criticized, especially in the most conservative county in the state, that, yeah, look at Washington County, they're just moving resources around, taking it from social service programs and moving it up into roads and funding big business. You're not doing that at all. As a matter of fact, you had an opportunity, saw that, look, this program works, we've got the data to prove it. Again, you put your money where your mouth is, and you should be commended for that. So let's talk a little bit about the top 3 accomplishments for the last couple of years. So I mentioned to many of you that the department heads and I are going through a book club right now as part of our monthly department head meeting. The book is The Leadership Challenge, and one of the concepts of the book is that you need to maintain credibility. Credibility is the foundation of leadership, and the foundation of credibility is this acronym, DWYSYWD. Do what you say you will do. You're going to see as we go through this, we are delivering on everything we say we tell people we're going to do. When we publicly put something out there and say, these are our strategic priorities, or these are 4 goals for 4 years, or this is what the 2018 budget's going to look like, we deliver on it. And if we can't deliver on that promise, we don't make the promise. So if you look at our 2018 budget, number 1 goal for that was to hold or reduce the current tax rate. We did that. Not only did we do it in 2018, and again, this is credit not just to this last county board, but decades of county boards. You've established the lowest tax rate in Washington County since World War I. Yeah, that's worth clapping for. That's not my applause line. Not only that, we have the 5th lowest county tax rate in the state of Wisconsin. There's a few who are lower than us, but I will take the 5th lowest, knowing what some of their fiscal situations are, being 4th, 3rd, 2nd, and 1st. Number 2, we initiated this a few years ago, reduce or eliminate the need to access fund balance or our savings account to balance the budget. We've been doing that, by the way, since 1999, to the tune of as much as $1.8 million a year during some years. We've lowered that in this budget to just over $900,000. That's the lowest level it's been since we started doing that back in 1999, which just, by the way, happens to be the year I graduated high school. So we're looking forward to continuing that path in the next few years, having that eliminated.
Supervisor Bossert?
Okay, you just touched on one of the things, which is making sure it's our long-term goal to not have any budget deficit. But the other thing is, this is how we're budgeting. When we actually run through the year, we're not actually coming in at a deficit and using reserves, correct?
That's correct. Yeah, and that's been the case on and off for most of the time since 1999. It was a little bit of creative budgeting, to put it in a nice way, to make sure that the budget had the money we needed in it, but usually the county has ended in a positive, and that's a credit to management by the department heads over the years, but especially in the last 4. The third goal for last year that we established was a 4th consecutive pay plan adjustment. It's worth mentioning again, for those of you who've been here, you've heard me say this over and over, but it's worth mentioning again that prior to my tenure, we had 3 consecutive years where we gave no raises at all to employees. That, of course, after 3 years' time, had its toll on employee morale. I'm proud to say that for the 4th consecutive year, we've given a cost of living adjustment. And not only that, in the goal that you would have seen in last year's State of the County address, we were shooting for 1% with a stretch goal of 2%. And we put it on the departments to say, if you can find the remainder of the money, about $125,000 as a group, we'll allocate it to this spot. And by the end of the process, they found it and they did it. So they were able to make that 2% happen. Finally, implementing the park sustainability plan. I talked about it briefly before. I just want to highlight a couple of things that are worth noting. Park implementation fee I touched on earlier. You're going to talk a little bit later in closed session about some of our efforts to do park sales and transfers. I think this is a very tangible example of priority setting and utilizing priorities to make decisions. Sandy Knoll Golf Course disc golf clubhouse rental. Is there anybody who's not familiar with this? Okay, so you're all familiar with the fact that we're renting out a clubhouse for disc golf. This is excellent. This hits like every area of what, when I first got to the county, I held this document up that said strategic priorities that had been on a shelf for like 4 years and we hadn't done much with it. And one of the things that it said was, we want to do more public-private partnerships with companies where they're doing the business and we're recouping some savings from that or some dollars from that. And this is an example of that. So Jamie's team over in Planning and Parks, Eric Hyde and the group, they did a fantastic job of establishing this super innovative way of doing business. Gets them business, gets us people coming into the parks, helps that number with the park fee implementation go up. It's a huge win-win all the way around. And I also mentioned the Homestead Hollow Dog Park. That's almost exclusively donated funds that are going to go and fund that initiative and that new amenity in our parks, including JW Speaker, a company down in Germantown who's recently announced a major expansion project that they're doing. This facility at the park is actually going to be presented by JW Speaker. So very exciting, another initiative in that venue. So number 2 in the top 3 is Carl's Place. I know many of you were able to be at the ribbon cutting. Picture of that on the bottom left. We were fortunate to have the Lieutenant Governor come and be a part of this exciting day. This property, for those of you who don't know, was really a piece of the county property that we transferred over. You'll notice that, I'm again going to beat you over the head with your own results. These 3 results are all touched by this project. Each and every one of them is something that we were able to accomplish, and again, through doing it via public-private partnership and not relying on county government to solve the problem. You don't have to listen to many radio stations or read many newspapers far outside the bounds of Washington County to find another county that actually would get into this business on their own. Instead, we had a nonprofit organization. We helped them make it happen. We worked together. It addresses safe and secure community in Washington County. It addresses access to basic needs. It addresses us running a well-governed and administered county. It's hitting all of the right spots for the priorities and the results that you set. It's a fantastic opportunity that's actually going to help people each and every day. All right, so this had to be the biggest thing that happened in Washington County, not just maybe in the last year, but it had to be in the last decade or so. So I thought it was worth highlighting. So I'm going to see if I can't get this to work. Some of you may have ended up seeing this. Let's see, one second. See if we can get it to fire up. So during the golf tournament, JS Online was out there, and a number of our deputies obviously were doing the security work, which I know most of you know about. And this little video, it's not very long, but it's kind of a neat highlight of some of the work that these guys were doing when they were out there. Anything special I have to do with the volume?
Is that knob there, Josh? Look at the system, go down, the white knob.
This here?
No, actually down on, to your right, look at the system where the DVR, DVD player is, and then there should be a white knob. It's turned all the way to the right, it's all the way up.
Yep, it's all the way
This
up.
is 99% on the screen.
Yeah,
It's all the way up.
that's it.
No dice?
No dice.
Yeah, that's what I was thinking.
What?
Yes, dice.
I didn't say D. I didn't say D's. Yeah, okay, fine, no D's. All right, well, I'll email this to you because it's kind of neat. Has anybody seen this? This video? Okay, it's cool. I'll email it to you. Oops. All right, just a few of the other projects in 17 and 18 that we were able to accomplish, and we're still in the process of some of them. The jurisdictional transfer of State Highway 83. I actually just received the draft version of the jurisdictional transfer agreement with the DOT today for State Highway 83, so excited about that. Driving shared services conversations in southeast Wisconsin. So there's a number of initiatives. Of course, one of those, you remember, we sent a letter to the surrounding counties asking them to partner with us. Shared ride taxi possibility was a discussion we had with Ozaki, which was a direct response to that letter. Parks Without Borders initiative with Waukesha County. Anybody in here not hear about that initiative? Everybody's familiar with it? All right, so that's a direct result of that letter. Regionalized UW extension. This has less to do with us and more to do with the UW, but it's a huge initiative that's still underway, and we're still seeing the ripple effects of that. And the regionalized juvenile detention facilities, this is an initiative that we're in the very early stages of. Some really high-level conversations happening at the moment. Some other minor ones that I didn't list but are worth mentioning, I included in my weekly update the other day where we're working with towns, town of West Bend and a salt initiative where they're redoing some work on their salt facility, all kinds of little projects like that are thousands of dollars at a time that our staff is focused on making happen. Some other things, the opioid manufacturer litigation, we continue to get updates on that. They're working through the process as we speak. Fiscal health presentations, I presented to over 500 people the state of the fiscal health of the county. Almost all of you have seen that presentation or a version of it. And unprecedented success with tax deed sales. I've got to give credit to our county clerk, Ashley Reichert, for being a little bit innovative, trying something a little different by using WisconsinSurplus.com to sell tax deed sales. We blew through some of our previous records for the amount we were able to capture back on those tax deed sales. I know the administrative committee had worked on some of those properties for quite some time. Couldn't get them to sell, We try this new effort, and in one time we get a sale. So kudos to her, and that helped big time. Not really with our budget, but helping put dollars back that should have been there in the first place. So 4 goals in 4 years. How many of you remember this initiative? Wow, you don't really pay attention to these state counties at all, do you? Now I'm going to, just for that, we got to add 15 minutes. So 4 goals for 4 years was something that I talked about in 2016. When about 3/4 of the way through that presentation, I know you will all religiously go back and pull those documents and those slideshows. You'll see exactly what you're seeing here without the successes listed. We had a number of concerns with regard to health insurance fund, which you just saw a little bit about, with regard to budget deficit spending, which we already touched on just briefly. There was serious concern on the board even before I got here about the compensation plan that we had just instituted and maybe the need to take a look at it again. And then our initiative to hold or reduce the county tax rate. So we made some promises back in 16. One of them was to reduce by $300,000 per year that annual deficit. We've done that every year. We're in a position now where after next year, we probably have the ability to knock that out completely. If we were extremely aggressive, we could probably do it next year, but we're on that planned path of reduction by $300,000 a year. Replenishing the health insurance fund. This is amazing. Talk about do what you say you're going to do. We had conversations with employees in the wake of that slide you saw earlier in the previous presentation, where we had $8 million planned spending, and we were really going to end up in the $10.5 million range. The reason Todd got a call the day before he started working for the county was I found out the day before that we were on track not only to have that kind of deficit, but we were going to completely spend our savings account that's dedicated to this fund. It would have been gone plus another $500,000. At that time, we did all of these reforms, which you just heard about, and a few more the following year because we were still scared crapless. And we told employees, you know, this is not easy. We know nobody liked the process that we went through, but it was an absolutely necessary process. We pulled in people from departments across the county to have that conversation. And we said, our goal is by 2021 that we're going to replenish the savings account for this fund to the tune of $3.2 million. I'm excited to report that at the end of 2017, we've exceeded that number by $700,000. By the end of 2018, I expect that number to approach $5 million. And so we're going to be in a position now where we can actually have a conversation for the first time since I've been here almost 5 years of, do we bring that expense line, planned expense line down, and therefore premiums on the county side and on the employee side potentially down? So now you start to get in discussions with administrative committee about, okay, we have a 12-year plan to get everybody up to the 12.5%. Does that happen faster? And better yet, employees don't even see the difference on the amount that's coming out of their pocket. This is a humongous initiative. This is a humongous success for the HR team, the finance team, the county in general, and really in the long run, it'll pay off not just for our organization, but for every employee that works here. So next, we promise to fully fund an overhaul of the 2012 compensation plan. You made this a strategic priority about a year ago now, just over a year ago. We are prepared to be presenting this month, actually next week, Monday, to the department heads, our first rough draft of what the scope of a new compensation plan might look like. Deputy Administrator Furno and Human Resources Director Scott are actually the ones who've kind of headed that up, and I've helped them work through the administratively feasible and tried to line it up with what I think is politically acceptable. And so hopefully in the coming months, the administrative committee is going to see an example of what we're kind of looking at and a timeline for implementing. And our goal at this point is to implement that plan in January of 2020. I will tell you something, that implementing that plan is going to cost us a lot of money. But because of the things that you've seen, and I won't make a promise I can't keep, we will find the money to fund this thing, and we'll do it without raising taxes or without having to ask you for new revenue sources. Finally, holding or reducing tax rates. Speaking of taxes, I already celebrated where we were at, but I just wanted to point out to you on the bottom of this, we've done that every single year. So from 2016 to 17, we achieved that goal. From 2017 to 18, we've achieved that goal. And based on how it looks, the new construction from this past year looked, it looks like we're gonna be somewhere in that 5 to 10, maybe even a little bit more range, where we'll be bringing that tax rate down again. So, in the theme of the leadership challenge, we are not only are we establishing credibility, we're living up to the words that we said. We're doing what we said we would do. So budget goals for 2019, we're going to utilize net new construction again. It's the biggest tool that helps us mitigate that long-term gap. But we won't do so if it means that we're going to increase tax rate. The tax rate and a minimum will stay the same. My goal is to reduce that. We also plan to reduce or eliminate the fund balance again by that 300,000 number. We'll stay to that plan. I would tell you that a stretch goal for that would be to either double that number or even completely eliminate the deficit. That would be an extreme stretch, but it could happen. Plan for a 5th consecutive pay plan adjustment. We're gonna be consistent with what we did last year, 1 to 2%. We'll also be cognizant of the pay plan, the compensation plan timeline, so we won't just do this willy-nilly. We'll consider what is approved by administrative committee in terms of the format, the context, and the timeline for our compensation plan. And finally, continue to implement these sustainability plans. So there will be several of these initiatives. You'll remember the Parks Fiscal Sustainability Plan. It was actually a 3-year plan. Jamie and her team will actually be presenting to Public Works Committee and to this county board in the next couple of months, talking a little bit about that plan, what phase 2 of that plan looks like. The initiatives that the ad hoc committee for the quasi-governmental groups that we work with, all of those will be addressed in some part, some way, shape, or form in the 2019 budget, and implementation of the 2050 Transportation Network Sustainability Plan will be part of this budget. So, state of the county is outstanding. I thank you for your time, and if you have questions, I'm happy to answer them.
Supervisor Boswell.
Yeah, thank you, Josh. Carl's Place, do they report to the Human Services Committee about the occupancy rate and so forth?
No, they don't, thank goodness. They're not a county department, so we haven't asked them to do that. We certainly could, just as a courtesy, but right now, Family Promise doesn't have an executive director, so we'd probably wait until that point if that's something we'd be interested in hearing about.
Yeah, because I would think you'd want, me as a board member would like to know what kind of occupancy do they have? You know, you can build it, but are they actually showing up?
Sure, I could actually ask once they get an executive director, maybe towards the end of this year. Maybe probably the best time would be at about the year mark anniversary to have that person come in and give you all a presentation.
I just want to make sure I follow up on the lady that was in charge of this. She's no longer part of it?
Right. She moved on.
Okay,
so they're looking for a new executive director.
Thank you.
Yep.
Okay, I want to expound a little bit. Oops, sorry. Supervisor Krebs.
Thank you, Mr. Chairman. Can you expand on the plan for this coming year of using the net new construction?
How would you like me to expand on it?
I guess what's the purpose of it, or is there a way that we don't have to use it?
Sure. I mean, if the board's directive as a whole was don't use net new construction or make it as small as possible, we could do that.
Or what's the advantage of taking advantage of it?
The biggest advantage is in order to keep down the gap from growing. That's our number one resource. Is property taxes, and because Washington County's fortunate to be growing at the pace we're at, what you'll likely see, just like you did last year, was we use net new construction, which produces last year the current year about $600,000, and the tax rate still dropped 10 cents. If we chose not to do that in years past, so I think my first year, and I know years before that, our focus wasn't on the tax rate, it was on the tax levy, and we were going to keep the tax levy flat. We could do that. It probably means we need to come up with $600,000 from somewhere else, and you're more than likely looking at quartile 3 and quartile 4 programs.
I've been approached, especially during this last election, some about how we're claiming the rates so low, but with the values going up everywhere, the tax bills aren't going down.
That's a misnomer. Just based on the way that assessments work in general, because not everybody's is going up. There are assessments that are going up, but the rapid pace at which assessments across the board are happening, and a lot of that being net new construction, it's not possible to actually keep the county's tax rate going up. And a lot of times, there are exceptions to this rule. The Village of Slinger is one of them. They just closed a TIF district, and they had a referendum, and Germantown had a referendum, and Kewaskum had a referendum in their schools. So their total tax bills get out of whack. But on the whole, if you look year to year, it's actually not. It isn't possible. So what's happening is because things are getting shifted around, that makes a difference. The other thing that makes a difference that we do is road and bridge aid. When we add on road and bridge aid taxation to the townships, they also see an increase on that too, which doesn't count towards the 10 cent per thousand decrease that we saw. It actually mitigates it a little bit. So It's a total philosophical discussion, tax rate versus tax levy. I know we've had that debate in the past. And whatever the board wanted to do as a whole, now would be the time to have that conversation or ask for it to be brought up.
Tonight's that time?
Yeah.
Thank you.
Okay, I wanted to bring up a little bit about what Josh talked about at that policy forum, which was rather very interesting to me. This is the point where Josh had to kind of hold me down. We've got the mayor of Milwaukee, mayor of South Milwaukee, the manager for Beloit, and a manager for Racine. All four of them stated, we cannot continue to provide the services that we are providing with the money that we're getting. I get, the light goes on, well, maybe you need to reassess, maybe you need to prioritize. We are so far ahead of the curve by doing what we're doing as a county. We can be an example and a leader for everyone to follow us, what we're doing here. Further initiatives, the priority-based budgeting is going to get us partway there, but being able to consolidate and merge services with other counties and other jurisdictions. We saved Washington County taxpayers $300,000 per year by merging services with Ozaukee County Mental Health Department. We were able to cut costs and increase services as a government entity. Now that's something that you don't hear about very often, but this is the route we can take. We can be leaders here. People are taking notice of what we're doing here in Washington County and what our team is able to do. And this is something that we really need to take a strong stand with and to continue to do this and to show the way. Supervisor McCune.
Thanks. So, this is the state of the county. You've gone with the plan. We've got the priority-based budgeting. If people want to bring it up, everybody's here tonight, and it is the easiest for them. So instead of hearing it behind and when everybody's not present to kind of talk through it, these are the kind of forums right now. If anybody wants to ask any of the questions here, it's a process that's gone on for a number of years. We haven't hit the tough part yet, as Josh and Donna said, that I think a couple other counties, and I think actually there's more towns and villages that are going to hit it quicker because of road conditions and things that they haven't taken care of or prioritized within their areas. So I think now is the time. So if anybody has comments for Josh and whatnot, I think this would be a good time. And as executive, we like to hear that, but for all the years I've been on executive, I get some phone calls, and occasionally we get someone to come to the meeting. But at the same time, I've heard things in the past where, well, why didn't we bring it up? Well, now is the perfect time. Everybody's here. We got plenty of time. And if there's a different direction, I think we ought to talk about it. So, thank you.
Supervisor Bossert.
Well, since we're on the topic, when we look at net new construction, I would be in favor of capturing that. And I think one of the big reasons is we're talking about borrowing, $22 million in the next 5 years to fund capital projects. Is that number right?
Yes.
Yeah. So if we're going to be borrowing $22 million, let's see if we can reduce that a bit by capturing all the net new construction.
Thank you. Anyone else? Supervisor Brandt.
Yes, the Village of Slinger has made a habit of using net new construction, and we've been fortunate to have, as communities in Washington County, one of the fastest growing. The other year, I think it was last year, we had like 3.4% in net new construction. Well, without that, your levy really stays level, and you have to consider you've got employee wages going up 1-2% a year. And if you're not capturing net new construction, I don't know how you cover those costs, including we've looked at road costs and, you know, the price of asphalt, the price of, especially as the economy gets better, your contractors' prices go up because there's not as many contractors really willing to bid on projects at a reasonable price. So I think it would be foolish for the county not to use the net new construction amount that's available.
Anyone else? You know, Josh talks about the only way that we can, you know, we're looking at a deficit coming forward. We're looking at ways to bridge that gap, to not take advantage. I know we did a few years ago that we didn't take advantage of that. And I think it's important that we do and use that to fill in it, help fill in the gap. Supervisor Bullock.
Josh, do you have an updated gap and what it looks like for the future?
Yeah, so the slide that I have up here, and it for whatever reason, when I hit slideshow, it looks odd, so I've still got it in the amending format or whatever, compatible view, I guess. So if you look on the right-hand side, this is our 5-year financial plan, the most recent one that we produced, which is about the rosiest picture we could possibly paint. It assumes that we take net new construction to the tune of about $600,000. It assumes that all of our expenditures stay basically as they are or lower. And it assumes that sales tax continues to perform as it's been performing. Some of those things we know not exactly to be true, but they might end up washing themselves out. So basically what happens is if you make a decision to not do net new construction for a year, you'll end up seeing, we'll close the gap, but you'll see longer term that bottom line flatten out, and then you need to, in one way, shape, or form, you need to either take revenue from somewhere else or you need to cut expenses on the top end, one or the other. So we certainly can do whatever you want to do. What I would tell you about net new construction today is if we decide not to, number one, it's not the end of the world like it used to be. You can go back in future years and take it at that point for the previous. So whereas I think 2 years ago that wasn't an option, now you can do that. So it's not the doom and gloom that we used to think of it as. The other thing is, if you do that, I'll be coming back to you and saying, here are 5 options or whatever for you to cut $600,000 out of your budget. Or maybe split the baby and say part of it we can create a new fee or generate new revenue, and part of it's going to come from service cuts.
Supervisor Mahalik.
Thank you, Mr. Chairman. I think actually what you had just said exposes the problem of not taking net new construction, and that is, before we couldn't do it, now we can. Well, we also know that the state giveth and the state taketh away, which means, of course, that they could turn off that spigot and it might not be an option. So it does make sense for us, as I think is evidenced by the direction you're getting here, that net new construction stay on the plate, that we would continue utilizing it so we don't end up losing it.
Supervisor Krebs.
Thank you, Mr. Chairman. I don't have my mind made up on net new construction or not, but a concern that I do have, and maybe it's a hurdle you can help me get over, is it just sounds like it's a way for us to take more money from the taxpayers and not examine the spending side of things. Instead of collecting more money, let's just not spend as much to start with. So I'm not looking for a debate tonight on it. It's a big picture that I don't have all the answers for either at this point, but it's something we should be looking at besides just grabbing all the money that we can right away. Thank you.
So that's absolutely fair comment. It's a ideological, philosophical question for the board. I think we have done more in the past 4 years. I know there's people across the Diaz from me who would say we've done too much in the past 4 years. of cutting the expense line, including a laundry list of positions. It doesn't look like it on the net number. I was going to mention this during the health insurance debate. It doesn't necessarily look like it on the net number. I think a lot of that is driven by the fact that our nursing home has hired a lot more people, or at least has a lot more people on the books. That drives that, and really the nursing home is separate from the levy. But we have, I think if you go department by department, and I was just having this conversation today, you're going to notice that there's a significant decrease in people. And if you look at this slide, people drive our budget. So 60% of our costs are people. When you add in nonprofits, which the chunk of that 27 million goes to, it probably pushes itself closer to 80%. So when you look 2014 compared to what will be 2019, I think we've done some of that. We're pushing up, as is demonstrated on the State of the County slide earlier. We're pushing up on quartile 3 and quartile 2 programs, where you're saying these programs are a priority. Now we would be going after those. Now I think there's something to be said to ask the question of what is the actual state mandate and what are we really doing. So there's definitely room for this. But unequivocally, if we make the decision, like we did for about a 10-year window, this board consciously made the decision that we're going to focus on the levy and keep the levy flat or reduce it. If we go back to that, then we necessarily are going to go back to the expense line. We absolutely can do it. There's no doubt about it. But you'll feel it, you'll hear about it, and it's going to be a programmatic level that you see it. So I'm here to carry out the will of the board. If the board wants to make the decision, if you want to have a discussion next month and say that levy versus tax rate, we can do that. We need to do it really quickly, but we can do that. But the sentiment I've gotten, the 5-year financial plan actually even spells out that net new construction is going to be utilized. If there's a divergence from that, then I need to hear it, because otherwise I'm going to be planning a budget that uses net new construction.
Supervisor Bullowa.
Josh, could you talk a little bit about our human services budget? We really haven't brought that up much at all. How are we doing with recovery of fees and things? I know for a while we missed opportunities for billing. I just want to see if we've gotten back on track on that. Are we recovering as much money as we should be on that? And then also, I think when I was on the committee, they talked about the triangle and some of the unexpected challenges. Can you talk about that a little bit?
Sure. So I haven't studied the human services budget recently, and I couldn't rifle off a bunch of data and numbers to make myself sound impressive and make you feel really comfortable. But yes, a couple years ago now, we had that backlog that wasn't received and lost, I think, $250,000 if I remember, and we were behind in the millions. Last year, you might remember that we recovered a significant portion of that in the $1 million range. We're again ahead of schedule this past year. We're actually now in the process of, we have new policies in place where we're actually collecting co-pays, which we've never done in the past. So I think the tide's beginning to turn. Julie Driscoll, our Human Services Director, has only been in place. It's been less than a year. So she's getting her feet under her, and I think things are changing. The tide is turning. Human Services is the second largest component tax levy of our budget, second to the Sheriff's Department. And so it's a huge component of what we do. One of the slides that I didn't include in the State of the County is we actually have broken down the mandated and non-mandated. You can actually see what percentage of our dollars are mandated, and it's about 67%. So it's a huge chunk of what we do, and a lot of that 67% is human services focused. So I think there are some opportunity areas there. We've made some conscious decisions to provide services way above the mandate. One example of that is our acute care service, our acute care services program. This is a program 24 hours a day, 7 days a week. We have social workers on call that work directly with law enforcement, take calls on mental health crises, what commonly referred to as Chapter 51s and Chapter 55s. We're literally spending millions of dollars a year on this program, and there's no mandate to do much of what's there, or the mandate that is there is significantly less than what we're doing. But I think if you talk to law enforcement, and we certainly heard it, I know Supervisor Dice was the chair when the police chief showed up when we tried to make a tweak to that program. It's a program that they rely heavily upon. It ties directly to access to basic needs. It ties directly to safe and secure community. It's hard to argue that it isn't a priority, but it's definitely not a mandate. So those are the kinds of decisions and discussions maybe you're driving towards. The more you focus on, now this number's a little bit old, 35 million. Tax levy, it's now closer to 36 million. But the more you focus on that number, the more you're gonna force the discussion for programs like ACS, which isn't mandated, or 4-H, which isn't mandated. I mean, those conversations are forced to the forefront because so much of our budget is mandated and we don't have a choice.
Supervisor McCune.
So for the last 2 years, the executive group has been consistent working with you on the priority-based budgeting, and as you said, we're going to be getting to the next level. We've taken the approach, and it's been consistent. There hasn't been anybody on executive that's fought this. We've worked together that we would keep our eyes open on all programs. So there are no sacred cows, and anybody from executive can correct me now if I'm misspeaking, but we've said we will look at all programs, try to independently and objectively look at each one. And when you get to the level of service, I think that's what you were alluding to, Josh, and maybe we should just mention it. You have ranges within performing things that are mandated that you can operate within. You can be at a 90% quartile, you can be at a 50%. There are requirements within mandated programs, and I think we're going to find at this county we've gone way above what is the mandated service level. So there's room there, but as we get closer to that 5-year gap, it will become tougher to take out that extra level of service. So we've decided we're keeping an open mind, but on all programs, we've said we're going to look at each one of them. So as we get further down, so for the next 2 years with this group, we're going to continually come back, and everybody out of the 26, no one is going to be, oh, this is protected. I'm on this committee. We've said no. Everything is fair game to look at, and it's going to come down to, as a group, where we want the priorities. In the past, we did say we're going to put more emphasis on public safety, for example, versus parks. So it's been in the paper. Obviously, it's proceeded with the projects we've done, but that's the approach we're intending to take with our first group of the executive meeting again, and going forward for the next 2 years, and in particular this next year. So that's our approach. So unless we hear from you otherwise, that's what we're running with. Thank you.
I think the other thing that's worth mentioning, and Supervisor McCune, I think, was alluding to, and I certainly was with regard to ACS, where you start to get with some of the programs that we've made a conscious decision to expand, and we'll keep using the ACS example because it's an easy one and it's a big number. We're actually making a conscious decision to spend more money on the crisis intervention mental health side, in the hopes that that mitigates costs later and down the road. So those public policy discussions end up kind of being a chicken or the egg argument, and what's the most appropriate way to handle either mental health or law enforcement issues. They're not wrong to have that conversation, but a lot of times you kind of get to loggerheads because someone made a decision years ago that was predicated on trying to save dollars. The OWI TAD grant was that in some ways. The judge, when he initially proposed the program be reinstated with county money, I kind of had to explain to him, you're going to spend $250,000 of county money, and you're not actually saving money on bed days. It's a misnomer. You're not, just because we don't put someone extra in the jail doesn't mean the sheriff doesn't have to staff the same amount of staff until you hit a certain threshold. So it becomes a quality of life, a morality type of a question. And those are the types of public policy discussions that we're bridging. I think Supervisor McCune was walking towards this. In year 5, you get closer and closer to have to make those types of decisions, especially if you decide that we're gonna go with focusing on tax levy instead of tax rate. It's not wrong. It's just what those conversations start to get forced much, much quicker.
Supervisor Basil?
Yes, thank you. To piggyback off of Supervisor McCune's comments, an executive, after the last 2 years, what you're going to see is you're going to see a lot more user fee base. I know it's another tax, but it's a tax for the person that uses it then. Because of the fact that what we're looking at down the line, that's where the parks was one of the first things. It's a user fee. If you use the parks, you're going to have to pay for it. I talked to people when I was out campaigning or getting my nomination papers, they all want bike trails. Three or four wanted bike trails. I said I have no problem with that as long as you're willing to, there's going to have to be a user fee base with it. And they all said they were fine with that. The other thing we're looking at is that's why we try to reach out to all the municipalities and the townships in the county. What can we help everybody with? Let's be one big team here. Let's try to, if we can't maybe get our taxes down, maybe we coalesce with some of the other townships, i.e. town of West Bend, with their salt. We can save them money, so maybe help them keep their costs down. That's what it's going to come down to, is the day of Washington County being by itself is over. It's a broken model. It has to be fixed. This is just one way we're trying to get through it, and maybe you can come up with a great way to keep this thing going. Thank you.
Any other questions? Thanks, Josh.
Thank you.
Okay, moving on to resolutions. Entertain a motion to introduce 2018 Resolution 10, amend the capital improvement plan, Sheriff's Office bodies. Supervisor Gonring, Supervisor Martin. Okay, any discussion on this? Sorry. To let everyone know, both these resolutions will take a 2/3 majority vote. No discussion, hearing no discussion. Move to call the question. You ready? Yes. Okay. Roger. Okay. Okay, passes 24-0. Moving on to 2018 Resolution 11, amend capital improvement plan and general fund transfer. Your motion. Supervisor Sorcy. Supervisor Parsons. Any discussion? Supervisor Jenkins.
I can let Josh go first if he wants.
Okay, thank you. So I've got a number of contacts over the week with regard to this particular resolution, and so I want to address a couple of things just to clarify, and acknowledging that 9 of you weren't here when some of the prelude to this resolution happened. So I'm looking right now at the April 17th County Board report and the accompanying committee report related to that. So this would have been March executive committee meeting. We had our capital improvement plan going through the process, and this was noted in that report. I had 4 major items of note, and the 4th one was that some projects are proposed to be removed from that CIP in anticipation of funding them instead with excess funds from the general fund and unspent funds specifically from the park system in 2017. So first and foremost, this was a planned expenditure as part of the 2019 to 2023 CIP process. I had noted it in the report at that time. I failed to note it at this time, and I apologize for that. Couple of other items, I just want to clarify some of the projects. Although they're spelled out, I want to make sure you understand exactly what we're looking at doing. First of all, the sheriff's dive team trailer and truck. Those projects had originally been requested in 2019 and 2020, if memory serves correctly. We're proposing to package those together as a general fund transfer now. Part of it has to do with the fact that our 2018 budget, or excuse me, 2017 budget, which you'll see in the 2018 audit, did just fine. The other thing is, as I mentioned during the State of the County address, the tax deed sales performed overly well, and so we're doing that good in that regard and have some extra dollars that could be utilized for projects such as these. The facility security system, this is really a software upgrade. It's not the type of project that's optional. It's also one of those things that I'm not super comfortable pushing off until 2019 or 2020. If we have the ability, and we do, to do that in 2018, then the funds are going to be available. This doesn't mean that the department or division is going to implement that in 2018 necessarily, but they're going to have the ability to do it. And when I say security system, I'm talking the system where we go into the doors, the locks that exist, and all of that tracking software that's related to that. Fire panel upgrades, I'm sure most of you who've worked with big buildings know what a fire panel is. We've had this on the radar for some time. This is exactly the same as the security system upgrade. I'm not comfortable holding off until 2019. Jamie and I had this discussion as we worked through the CIP process. It hadn't been on the previous plan, so they really had no choice but to submit it as part of the 2019 to 23 projects. But I think putting the money aside specifically for that project makes more sense than holding off for another year. And finally, the Schmidt Road closure, which we've spelled out here. I think you're all familiar with this project. It was part of an agreement between the city and the county. The city made the decision to expedite the project, move it up into 2018 rather than, I believe their deadline was actually 2019, or it might have even been 2020. So we're moving the dollars up now because that project's happening. I think I put that in my weekly update. It's actually happening in July and it'll be completed by October. So we needed to line up our timeline with their timeline. There's also other dollars that are associated with that too. They're not part of this general fund transfer. They were actually part of previous capital improvement plan where we actually are going to be writing a check to the city. My memory serves correctly, is $125,000 at the front end of that project to partially fund the extension that they need to, the connection they need to make off of Rolfs Road to Creek and River Road, or to Creek and Schmidt Road, excuse me. And then another $125,000 will come on the back end of that project once the punch list is finished as well. So not directly related to what you're seeing in front of you, but it is associated with it. So when you see that come across, I wouldn't want you to think we snuck one by you. So I think that's the gist of what I need to tell you.
Okay, Supervisor Jenkins.
Sure. And I apologize, I might just be ignorant because I'm new. But I just wanted to make sure that the previous board hadn't just approved the CIP without having money set aside for it. That's because that's what it came across as.
Okay. Yeah. No, you're correct. We have the money set aside for it. Yep. So in this particular case, right now that money would be considered undesignated fund balance for the accountants in the room. For everyone else, our savings account has grown again, which is a good thing. Our policy dictates that savings account sits somewhere in that 15 to 16 million range. If Margie's not here, she's on her way back from a conference in St. Louis, but if my memory serves right, 15 to 16, and we're going to be pushing closer to 17 or 18 pretty soon. And so this is a great opportunity to pick up projects like this with money that we've really deferred because we budgeted well.
Got it. Thank you.
Supervisor Mahalik.
Thank you, Mr. Chairman. And deferred, I think, is the correct word as regards to the reason that these were placed, and specifically the one other item that was you didn't mention was, of course, the $107,000 for the asphalt maintenance.
Oh, yeah.
If we let that go, what ends up happening is it creates damage to that substructure of the asphalt that's sitting on top, and there's a multiplier effect. So by doing this sooner, and that's why facilities management brought it up to us, to keep it from getting more and more expensive, it makes much more sense to do it now, and then we don't have the additional expense of having to do a much more expensive reconstruction. So this really does make a lot of sense.
That's right, and I should have, thank you for bringing that up. I think Supervisor Mahalik brought that question up at executive, if I remember right. And the other thing that was brought to our attention is the County Highway P is being reconstructed this year, which is adjacent to this project.
Right.
We got a bundle of projects, of parking lot projects at Fair Park bid on. We had, as we oftentimes do, we had a base bid and then we had alternate bids. The numbers came in good. I'm sure part of it has to do with the fact that they're working on County Highway P just down the road. And our staff engineer will be out there literally less than a mile away from this site. So there's a lot of reasons why it makes sense to do it now. Now, we're gonna pay ourselves back. So 2019, we have actually budgeted through the CIP to have this 107 available. So we'll pay ourselves back in 2019, but we need your permission to be able to basically pre-spend money.
Supervisor Krebs.
The last part you just alluded to, that we'll pay ourselves back. So are there other projects that didn't make the grade or the cut for farther years out that wouldn't just fill that spot instead?
No, so what we planned, the only projects that didn't make the list, or didn't make the cut, as you said, was one project, to put some security improvements, on the face of the, Sheriff's Department and Justice Center. What I'm gonna propose, coming up in this next strategic planning process for the board is that we contemplate a campus security review, and have somebody come in and walk through some of the things we should do, prioritize them, and fund them. So that would be the only project, I think, if I remember right, that was $25,000. The rest of the projects made the list. Department heads in the last 4 years have been pretty good about not submitting projects that I would call frivolous or even questionable. Pretty much all of their projects are needs, not wants. They don't typically, there have been an exception or two, but for the most part, they're things that they need to have.
Okay, thank you.
Okay. Supervisor Gauss.
Thank you, Chair. Josh, when you say the unaudited, so I'm assuming our in-house staff, our finance accounting folks came up with that 1 million excess. Being new, when does the final audited report come back?
So you'll have a presentation, usually it's somewhere between June and August, just depending on where things left. The auditors, I think, left last week, if I'm not mistaken. We have 2 CPAs on staff though, so we do a lot of the work that we can under the restrictions of certainly having somebody else come in and look at our books. But the preliminary numbers are advantageous for us. And this is overall budget performance. It's not specifically sales tax or general fund. This is overall performance of the budget.
See no further questions. We'll vote on this electronically. Ready?
Yep.
Motion passes 24-0. Okay, we're going to look at closed session, but does anybody need a break? We will take a 5-minute break. Have the Sergeant at Arms open the doors. Okay, all right. Okay, now we will consider 2018 Resolution 12. Do I have a motion to accept? Supervisor Jenkins, Supervisor Kelling? Any further discussion on the matter? All those, wait.
Uh-oh.
Hold on. We're waiting.
Yep.
Okay, all those, will vote electronically. Jenkins. Motion passes unanimously. Okay, next meeting date, Wednesday, June 13th, 2018, at 6 o'clock PM. Same time, same place.
Same bat time,
Yeah.
same bat channel.
Under Slave and Guyring. All in favor, signify by saying aye. Aye. Any opposed? We are hereby adjourned. Thank you, everybody. Thank you, everyone, for coming.